The United States has seen an increase in opioid deaths since the opioid crisis began in the 1990s, with more than 1 million people dying from a drug overdose since 1999. The third wave of the opioid crisis began in 2013 with the introduction of synthetic opioids, mainly illicit manufactured fentanyl. The market for illicit fentanyl continues to change, with it being found in combination with heroin, counterfeit pills, cocaine, and other substances, and deaths involving multiple drugs. The Centers for Disease Control and Prevention states, in 2021, that nearly 88% of opioid-involved overdose deaths include a synthetic opioid such as fentanyl. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine. A lethal dose of fentanyl is considered to be 2 milligrams. The DEA states that more than 59 million fentanyl-laced fake pills and more than 13,000 pounds of fentanyl powder were seized in 2022. These seizures are equivalent to 396 million lethal doses of fentanyl. Signs of opioid overdose. Those first on the scene may not know if the person is experiencing an overdose or if the overdose is caused by an opioid. It is best to treat all encounters as if it is an opioid overdose. Naloxone is not harmful to people who are not experiencing an opioid overdose. Signs of an opioid overdose can include small, constricted, pinpoint pupils, falling asleep or losing consciousness, slow, weak, or no breathing, choking or gurgling sounds, limp body, cold and/or clammy skin, discolored skin, especially on lips and nails. Naloxone. Naloxone is an opioid antagonist, which means that it blocks the opioid from adhering to receptors, thereby reversing respiratory depression, sedation, hypertension, and analgesia caused by the opioid. It has a quick onset and does not have a long duration of action, which makes multiple doses necessary when the opioid is potent. Naloxone does not reverse the overdose effects of other substances. However, many of these substances being sold on the street are contaminated with fentanyl. Therefore, naloxone can and should be administered. Naloxone acts quickly, does not produce physical or psychological dependence, and has few side effects, most of which are minor. Overdose withdrawal, the most common side effect of naloxone, can cause shaking, sweating, nausea, and anger. Allergic reactions are rare. It is crucial to store naloxone at a temperature below 77 degrees Fahrenheit while avoiding freezing. Furthermore, it should be protected from light at all times. Please note, temperature excursions up to 104 degrees Fahrenheit are permissible. Also, be aware of the expiration date that is marked on each naloxone kit. How to administer naloxone. Check the person for unresponsiveness and slowed breathing. Lay the person on a flat surface and their back. Tilt head up. Call 911 if emergency medical services have not been contacted. Administer 1 full dose of naloxone in 1 nostril. There is 1 dose in each bottle. Do not prime the bottle. To do this, remove naloxone from packaging. Tilt the victim's head back. Position thumb on plunger and fingers on either side of the tip. Insert the tip into the victim's nostril until your fingers touch their nose. Firmly press the plunger until the entire dose is released. Then, continue rescue breathing if breathing remains slow. Wait 2-3 minutes. If the patient is not responsive and breathing continues to be slow, give a second dose in the other nostril. Depending on the potency of the ingested opioid and the medical history of the patient, more than 2 doses of naloxone may be needed to reverse an opioid overdose. With timely recognition of the signs and symptoms and proper administration of naloxone, potentially hundreds of lives can be saved.